Question 1. A hospitalized patient with suspected pulmonary tuberculosis is coughing and awaiting confirmatory tests. Which immediate action most appropriately reduces airborne transmission risk? A. Place the patient in a single room with a closed window and start N95 respirators for staff entering the room. B. Transport the patient to radiology without mask, but instruct staff to stand greater than 3 feet away. C. Place a surgical mask on the patient and continue routine care without isolation. D. Delay isolation until AFB smear results return positive. Answer. A. Place the patient in a single room with a closed window and start N95 respirators for staff entering the room. Rationale. Airborne precautions require a single negative pressure, if available, room and respiratory protection, N95, for staff to prevent inhalation of droplet nuclei. B is wrong because transport without a mask increases exposure risk. C is insufficient. Surgical masks on patient help, but do not replace airborne precautions for staff. D is unsafe. Waiting for smear delays protection and risk transmission. Question 2. While caring for a patient with Clostridioides difficile diarrhea, which practice most effectively prevents environmental transmission to other patients? A. Using alcohol-based hand rub after glove removal and before leaving the room. B. Performing hand hygiene with soap and water and using sporicidal surface disinfectants on touch surfaces. C. Cleaning surfaces weekly with quaternary ammonium compounds. D. Wearing gloves only during direct contact with stool and not for handling linens. Answer. B. Performing hand hygiene with soap and water and using sporicidal surface disinfectants on touch surfaces. Rationale. C. Difficile spores resist alcohol. Soap and water hand washing physically removes spores. Environmental cleaning with sporicidals, for example bleach, is essential. A is incorrect. Alcohol rub is ineffective against spores. C is wrong. Weekly cleaning is insufficient for high-touch surfaces. D is wrong. Gloves should be used appropriately and contaminated linens handled with care and cleaned properly. Question 3. An ED nurse notices 3 patients on the same shift develop fever and vomiting within 8 hours after attending the hospital cafeteria. What is the nurse's best immediate infection control action? A. Notify infection control and initiate an outbreak investigation while securing food source and implementing enhanced hand hygiene and contact precautions for symptomatic patients. B. Begin empiric broad-spectrum antibiotics for all 3 patients. C. Assume community-acquired foodborne illness and take no facility action. D. Place symptomatic patients in the same room without personal protective equipment to conserve resources. Answer. A. Notify infection control and initiate an outbreak investigation while securing food source and implementing enhanced hand hygiene and contact precautions for symptomatic patients. Rationale. Cluster of similar symptoms suggests an outbreak. Immediate reporting, source control, enhanced infection prevention, and cohorting with precautions are required. B is inappropriate. Antibiotics are not first line for suspected foodborne outbreaks and could be harmful. C neglects facility responsibility. D increases nosocomial spread and is unsafe. Question 4. A patient refuses recommended isolation for a confirmed multi-drug resistant organism MDRO because of perceived stigma. Which action best balances patient autonomy and infection prevention? A. Respect refusal and discontinue isolation to honor autonomy. B. Explain the rationale, document refusal, attempt negotiated alternatives, private room education, and implement other protective measures while notifying the care team. C. Force isolation despite the patient's objections. D. Ignore the refusal and continue care as if the patient were isolated without documentation. Answer. B. Explain the rationale, document refusal, attempt negotiated alternatives, private room education, and implement other protective measures while notifying the care team. Rationale, ethical approach. Respect autonomy, but use informed consent process, clear communication, and try to reach agreement. Document and use other measures to protect others. A fails to protect public health. C is coercive and legally fraught except in rare public health orders. D is dishonest and unsafe. Documentation and team notification are essential. Question 5. During donning PPE for an aerosol-generating procedure on a COVID-positive patient, which sequence minimizes contamination risk? A. Perform hand hygiene, gown, N95 respirator goggles, or face shield gloves. B. Gown, gloves, N95 respirator goggles, or face shield hand hygiene. C. N95 respirator, gown, goggles, gloves, hand hygiene. D. Gloves, gown, N95 respirator goggles, hand hygiene. Answer. A. Perform hand hygiene, gown, N95 respirator goggles, or face shield gloves. Rationale. Standard donning sequence that minimizes cross-contamination puts gown on before respirator and goggles, with gloves last. Hand hygiene first is necessary. B and D have incorrect ordering, gloves before respirator or goggles. C places respirator before gown, which can be acceptable in some protocols, but best practice is gown, then respirator, then eye protection, then gloves. A is the safest sequence. Question 6. A central line-associated bloodstream infection (CLABSI) is suspected in a septic patient. Which immediate nursing action most directly reduces future CLABSI risk while preserving patient safety? A. Remove the central line immediately without consulting the team. B. Perform full sterile dressing change, obtain blood cultures per protocol, and coordinate review for line necessity and removal if indicated. C. Start empiric antifungals and leave the line in place indefinitely. D. Flush the line vigorously with normal saline to clear suspected biofilm. Answer. B. Perform full sterile dressing change, obtain blood cultures per protocol, and coordinate review for line necessity and removal if indicated. Rationale. Appropriate steps. Follow CLABSI protocol. Obtain cultures before antibiotics. Assess line necessity. Perform sterile dressing change. Removal only if indicated. A is rash. Team coordination is necessary. C is wrong. Empiric therapy may be needed, but indiscriminate antifungals and keeping the line is poor practice. D is unsafe. Vigorous flushing can dislodge thrombi or spread organisms. Question 7. In a busy ward with limited single rooms during an influenza surge, which cohorting strategy best maintains infection control and patient safety? A. Cohort patients with confirmed influenza together and restrict staff assignments, while separating non-influenza febrile patients into the general cohort. B. Cohort confirmed influenza patients together and assign dedicated staff to those patients. Maintain signage and droplet precautions. C. Place influenza patients anywhere and rely on masks for staff only. D. Cohort influenza patients with immunocompromised patients to monitor them closely. Answer. B. Cohort confirmed influenza patients together and assign dedicated staff to those patients. Maintain signage and droplet precautions. Rationale. Cohorting confirmed cases with dedicated staff reduces cross-transmission. A is incorrect because mixing non-influenza febrile patients risks spreading influenza to others. C is inadequate. D is dangerous. Do not place immunocompromised patients with infectious cohorts. Question 8. A surgical unit is evaluating reusable laryngoscope blades, which reprocessing policy best aligns with infection prevention standards to prevent device-related transmission, a use high-level disinfection or sterilization per manufacturer instructions, and track device reprocessing cycles. Single-use when validated single-use devices are recommended to be. Wipe blades with alcohol between patients and store on the anesthesia cart. C. Rinse blades with tap water and dry before reuse. D. Only staff judgment determines whether to sterilize based on perceived contamination. Answer. A. Use high-level disinfection or sterilization per manufacturer instructions and track device reprocessing cycles. Single-use when validated single-use devices are recommended. Rationale. Reprocessing must follow validated manufacturer and facility policies. Sterilization for critical devices. Tracking ensures traceability. B and C are inadequate. Alcohol wipe and tap water insufficient. D is unsafe. Subjective judgment is not acceptable. Question 9. A patient with suspected measles was in the waiting room for 2 hours. What immediate institutional step best protects other patients and staff? A. Identify exposed individuals. Notify occupational health and public health as required. Offer MMR vaccination to susceptible staff or patients within recommended time frame. And implement airborne precautions for the index case. B. Close the ED for 24 hours. C. Only advise the index patient to stay home. No additional action required. D. Offer antiviral therapy to all exposed patients immediately. Answer. A. Identify exposed individuals. Notify occupational health and public health as required. Offer MMR vaccination to susceptible staff or patients within recommended time frame. And implement airborne precautions for the index case. Rationale. Measles is highly infectious. Contact tracing, notification, post-exposure prophylaxis, MMR vaccine within 72 hours, and isolation are key. B. Is extreme and impractical. C. Is insufficient. D. Is incorrect. Antivirals are not standard post-exposure for measles. Vaccination or immune globulin as per guidance is indicated. Question 10. After a needle stick from a known HBV-positive patient, what is the nurse's most appropriate immediate action? A. Squeeze the wound hard to remove blood and wait for symptoms. B. Encourage bleeding, wash with soap and water, report the exposure, and follow institutional PEP and testing protocols. HBV vaccination or IG as indicated. C. Apply a tourniquet and attempt to aspirate blood from the puncture. D. Ignore if wearing gloves because penetration reduces risk to negligible. Answer. B. Encourage bleeding, wash with soap and water, report the exposure, and follow institutional PEP and testing protocols. HBV vaccination or IG as indicated. Rationale. Standard post-exposure. Encourage bleeding, immediate washing, report, and follow PEP and testing. A. Squeezing hard is not recommended. C. Is dangerous. D. Is false. Glove puncture can still transmit bloodborne pathogens. Question 11. A patient on contact precautions for VRE requires physical therapy in the gym. What is the safest plan to reduce transmission while preserving rehabilitation? A. Transport patient to gym without precautions to avoid deconditioning. B. Conduct therapy at bedside or in a designated area with dedicated equipment or thoroughly disinfect equipment between uses. And ensure staff use appropriate PPE. C. Cancel all therapy for the duration of VRE colonization. D. Allow patient to go to gym if they wear a surgical mask only. Answer. B. Conduct therapy at bedside or in a designated area with dedicated equipment or thoroughly disinfect equipment between uses. And ensure staff use appropriate PPE. Rationale. Balance rehab needs and infection control by using dedicated equipment or area and cleaning and staff PPE. A. Increases spread. C. Denies needed care unnecessarily. D. Is inadequate. Mask only does not address contact transmission via surfaces. Question 12. In the middle of an MDR organism outbreak, what is the most effective stewardship-related nursing action to reduce selection pressure? A. Advocate for antibiotic timeouts, review indications and durations with prescribers, and ensure cultures are obtained before antibiotics. B. Stop all antibiotics immediately for all patients. C. Increase prophylactic antibiotics to prevent superinfection. D. Only follow physician orders without questioning antimicrobial use. Answer. A. Advocate for antibiotic timeouts, review indications and durations with prescribers, and ensure cultures are obtained before antibiotics. Rationale. Antimicrobial stewardship actions, timeouts, appropriate durations, cultures before therapy. Reduce selection pressure. B. Is dangerous. C. Worsens resistance. D. Misses opportunities to influence safe prescribing. Question 13. A ventilated ICU patient has rising ventilator-associated pneumonia (VAP) rates unit-wide. Which bundle change should the nurse prioritize to reduce VAP incidence? A. Strict elevation of head of bed, daily sedation interruption and assessment for extubation, oral care with chlorhexidine per protocol, and subglottic suctioning when indicated. B. Increase frequency of ventilator circuit changes to daily. C. Use prophylactic systemic antibiotics for all ventilated patients. D. Replace endotracheal tubes every 48 hours. Answer. A. Strict elevation of head of bed, daily sedation interruption and assessment for extubation, oral care with chlorhexidine per protocol, and subglottic suctioning when indicated. Rationale. Evidence-based VAP prevention bundle reduces risk. B. Daily circuit changes is unnecessary and may increase risk. C. Is inappropriate. D. Is invasive and not supported. Question 14. A postoperative patient is febrile and wound drainage is cloudy. Which initial nursing action most accurately follows infection control and diagnostic priorities? A. Obtain wound culture using aseptic technique, notify surgeon, implement contact precautions if indicated, and ensure appropriate wound care and source control. B. Start broad-spectrum antibiotics without cultures. C. Cover the wound and observe for 72 hours before reporting. D. Discontinue wound care to prevent staph exposure. Answer. A. Obtain wound culture using aseptic technique, notify surgeon, implement contact precautions if indicated, and ensure appropriate wound care and source control. Rationale. Cultures before antibiotics enable targeted therapy. Source control and appropriate precautions are critical. B. Risks inappropriate therapy and hampers targeted treatment. C. Delays necessary action. D. Is unsafe and neglectful. Question 15. When is cohorting of patients colonized with different MDROs acceptable? A. Never. Patients with different MDROs must always be isolated separately. B. Only when pathogens have similar transmission routes and cohorting is supported by infection control with dedicated staff and clear signage. C. Always cohort any colonized patients together to conserve rooms. D. Cohort only if patients consent in writing. Answer. B. Only when pathogens have similar transmission routes and cohorting is supported by infection control with dedicated staff and clear signage. Rationale. Cohorting can be used when organisms share transmission mode and facility policies allow with precautions. A. Is too rigid. C. Is unsafe. D. Is not the determining factor. Consent alone doesn't mitigate transmission risk. Question 16. A nurse must remove PPE after exiting a room with contact and droplet precautions. Which doffing step most reduces self-contamination risk? A. Remove gloves first, then perform hand hygiene. Then remove goggles or face shield, gown and respirator or mask last, with hand hygiene between steps as indicated. B. Remove gown and gloves together, shake them off, then touch face to adjust mask. C. Remove respirator first while still in the room, then gloves. D. Take off gloves and gown together and leave mask on forever. Answer. A. Remove gloves first, then perform hand hygiene. Then remove goggles or face shield, gown and respirator or mask last, with hand hygiene between steps as indicated. Rationale. Proper doffing order reduces self-contamination. Gloves, most contaminated, first. Hand hygiene between steps and respirator last. B. Shaking spreads contamination. C. Removes respirator too early. D. Is incorrect. Question 17. A patient with suspected Ebola-like hemorrhagic fever presents. Which institutional actions are highest priority for protecting staff and public? A. Immediately implement high-level isolation with trained team and full PPE. Restrict access, notify public health authorities, and follow strict transport and waste disposal protocols. B. Manage in standard ward with gloves and masks only. C. Allow family to care for patient without training to preserve comfort. D. Wait for laboratory confirmation before any special precautions. Answer. A. Immediately implement high-level isolation with trained team and full PPE. Restrict access, notify public health authorities, and follow strict transport and waste disposal protocols. Rationale. For high-consequence pathogens, immediate isolation, use of specialized teams, notification, and strict waste management are required. B and C are dangerously insufficient. D. Delays critical containment and endangers others. Question 18. A unit wants to implement UVC room decontamination after patient discharge. Which statement reflects best practice for integrating UVC? A. Use UVC as an adjunct to manual cleaning. only after thorough manual cleaning of high-touch surfaces, and ensure safety protocols to prevent staff exposure to B. Replace manual cleaning with UVC to save time. C. Use UVC for 2 minutes from hallway without entering the room. D. Rely on UVC alone to inactivate C. difficile spores reliably without manual cleaning. Answer: A. Use UVC as an adjunct to manual cleaning, only after thorough manual cleaning of high-touch surfaces, and ensure safety protocols to prevent staff exposure. Rationale: UVC is adjunctive. It cannot replace manual cleaning because organic matter blocks efficacy. Safety interlocks and proper cycles are necessary. B and D are incorrect. C. Insufficient exposure and positioning is ineffective. Question 19. A nurse discovers that a sterile instrument tray may have been exposed to non-sterile air for 10 minutes. What is the best infection control response? A. Consider the tray potentially non-sterile. Remove from use, reprocess, or open a new sterile tray, and document the breach. B. Use the tray if no visible contamination is present at C. Quickly wipe instruments with alcohol and proceed. D. Ask the surgeon if they want to proceed and let them decide without reprocessing. Answer: A. Consider the tray potentially non-sterile. Remove from use, reprocess, or open a new sterile tray, and document the breach. Rationale: a breach exposure to air invalidates sterility. Reprocessing or new tray required. B and C are unsafe. D abdicates responsibility. Final decision requires maintaining sterility standards. Question 20. In prioritizing daily tasks during an MDR organism surge with limited staff, which triage decision best balances patient safety and infection control? A. Prioritize care that reduces transmission risk first, for example source control, isolation adherence, high-risk procedures. Delegate stable tasks, and coordinate with infection control for resource allocation. B. Triage purely by chronological order of assigned rooms. C. Focus only on life-threatening tasks, and ignore infection control measures temporarily. D. Assign the least experienced staff to all high-risk patients to provide learning opportunities. Answer: A. Prioritize care that reduces transmission risk first, for example source control, isolation adherence, high-risk procedures. Delegate stable tasks, and coordinate with infection control for resource allocation. Rationale: during surge, prioritize actions that prevent spread and harm. Source control, proper precautions. Use delegation appropriately and coordinate. B is arbitrary. C sacrifices prevention and increases overall risk. D is unsafe. Match skill level to task complexity. Question 21. You have 4 patients requiring immediate attention during an outbreak of carbapenem-resistant enterobacterals, CRE. Which patient should the nurse assess first to prevent further transmission? A. A patient newly admitted from another facility with incomplete infection control documentation. B. A patient with confirmed CRE who is properly isolated. C. A patient discharged this afternoon who needs final paperwork. D. A patient with no infection symptoms but requesting pain medication. Answer: A. A patient newly admitted from another facility with incomplete infection control documentation. Rationale: new admissions can unknowingly introduce MDR organisms. Unknown colonization status poses highest spread risk. B is already isolated. C is administrative. D is non-urgent. Question 22. A patient with measles was mistakenly placed on Droplet instead of Airborne Precautions for 5 hours. The unit has 14 susceptible staff exposed. Which infection control action should occur first? A. Immediately report exposure to occupational health and initiate post-exposure prophylaxis for susceptible staff. B. Move the patient to a private droplet room. C. Begin mass vaccination of all hospital visitors. D. Perform antibody titers on all patients on the unit before doing anything else. Answer: A. Immediately report exposure to occupational health and initiate post-exposure prophylaxis for susceptible staff. Rationale: measles is extremely contagious. Susceptible staff need urgent prophylaxis within 72 hours. B is wrong, requires Airborne, not Droplet. C is unrealistic and unnecessary. D delays required PEP. Question 23. A nurse must prioritize equipment sterilization after a sudden autoclave failure. Which device should be sterilized first to prevent the greatest infection risk? A. Surgical instruments for a scheduled non-urgent biopsy. B. Central line insertion kits. C. Blood glucose monitor. D. Stethoscopes shared between nurses. Answer. B. Central line insertion kits. Rationale. Central line insertions are critical risk procedures requiring sterile equipment. Biopsy is elective. Glucose monitors require disinfection, not sterilization. Stethoscopes use cleaning, not sterilization. Question 24. A cluster of surgical site infections appears 2 weeks after a new scrub sink installation. Which initial epidemiologic action best identifies the source? A. Culture water from sink aerators and drains while performing a case control review of infected versus non-infected patients. B. Increase antibiotic prophylaxis for all surgeries. C. Ban all hand washing in the or until investigation is complete. D. Move all surgeries off-site until sink is removed. Answer. A. Culture water from sink aerators and drains while performing a case control review of infected versus non-infected patients. Rationale. Environmental sampling plus epidemiologic comparison is the proper outbreak investigation. B. Increases resistance. C. Is impossible. D. Is extreme and premature. Question 25. A patient on airborne plus contact precautions requires emergency CT scanning. Which transport plan minimizes transmission risk? A. Place a surgical mask on the patient, cover wounds, notify CT team, clear hallway during transport, and ensure receiving room prepared. B. Transport without mask to avoid distress. C. Delay CT until isolation ends. D. Ask the patient to self-isolate in the hallway briefly before transport. Answer. A. Place a surgical mask on the patient, cover wounds, notify CT team, clear hallway during transport, and ensure receiving room prepared. Rationale. Masking patient, covering sources, coordinating with CT, and clearing traffic minimize spread. B, C, D are unsafe and inappropriate. Question 26. A ventilated patient suspected of VAP needs bronchoscopy samples. Which action best prevents cross-contamination of bronchoscope channels? A. Use high-level disinfection validated for bronchoscopes and perform leak testing before reprocessing. B. Rinse the scope with tap water only. C. Reuse without cleaning if used on the same patient. D. Soak the scope in alcohol for 5 minutes. Answer. A. Use high-level disinfection validated for bronchoscopes and perform leak testing before reprocessing. Rationale. Bronchoscopes require strict reprocessing. Leak testing prevents internal contamination. B, C, D are inadequate or unsafe. Question 27. In a norovirus outbreak, bed turnover time is 40 minutes, but proper terminal cleaning requires 75 minutes. What is the safest infection control decision? A. Reduce admissions temporarily until full terminal cleaning time can be met consistently. B. Shorten cleaning time to maintain patient flow. C. Skip terminal cleaning for low-risk patients. D. Place new patients in rooms immediately after discharge. Answer. A. Reduce admissions temporarily until full terminal cleaning time can be met consistently. Rationale. Norovirus requires thorough environmental cleaning. Patient flow cannot override safety. B, C, D increase outbreak size. Question 28. A nurse is triaging 4 patients who are all exposed to the same MERS-CoV index case. Which patient should be isolated first? A. A coughing healthcare worker with recent unprotected exposure. B. A fully vaccinated visitor with no symptoms. C. A patient who passed by the infected patient briefly in the hallway. D. A patient who received care from a nurse who once cared for the index case 2 days prior while masked. Answer. A. Coughing healthcare worker with recent unprotected exposure. Rationale. Symptomatic plus unprotected exposure equals highest transmission risk. B. Low risk. C. Limited exposure. D. Mass care is lower risk. Question 29. A nurse must calculate safe room placement. A ward has 2 negative pressure rooms. For patients require airborne precautions. Which 2 should get the negative pressure rooms first? A. A patient with active TB, coughing heavily, and a patient with measles, with extensive rash. B. A patient with measles and a patient with influenza. C. A patient with TB, on treatment times 3 weeks, and a patient with varicella-zoster crusted lesions. D. Any 2 patients chosen randomly. Answer. A. A patient with active TB, coughing heavily, and a patient with measles, with extensive rash. Rationale. Highest transmission risk. Untreated TB plus measles during rash or catarrhal stage. Influenza uses droplet. Treated TB and crusted varicella are lower risk. Question 30. A neutropenic patient is assigned a roommate with MRSA due to crowding. Which action is most appropriate? A. Immediately reassign the neutropenic patient to a private protective environment room. B. Keep both in same room, but separate by curtains. C. Allow roommate placement only if both patients agree. D. Keep as is because MRSA does not affect neutropenia risk. Answer. A. Immediately reassign the neutropenic patient to a private protective environment room. Rationale. Immunocompromised patients require protection. Placing with MRSA is unsafe. B. Inadequate. C. Consent does not mitigate clinical risk. D. False. Question 31. A dialysis patient is suspected of having Candida auris. Which infection control action must the nurse take before starting dialysis? A. Notify infection control and dialysis unit. Ensure dedicated dialysis machine or terminal disinfection. And place patient on contact precautions. B. Proceed with dialysis normally. C. Use alcohol wipe down only. D. Delay all care for 24 hours. Answer. A. Notify infection control and dialysis unit. Ensure dedicated dialysis machine or terminal disinfection. And place patient on contact precautions. Rationale. C. auris is highly resistant and spreads via devices. Requires strict precautions plus dedicated equipment. Question 32. During AC difficile outbreak, unit-wide compliance is 64%. What is the nurse's highest priority action to reduce transmission? A. Reinforce hand washing with soap or water and environmental cleaning with sporicidal agents and audit compliance with real-time feedback. To B. Increase alcohol-based sanitizer use. To C. Stop surveillance because outbreak is already known. D. Cancel all admissions until compliance reaches 100%. Answer. A. Reinforce hand washing plus sporicidal cleaning plus auditing. Rationale. Soap or water plus sporicidal cleaning is essential for spores. Auditing improves compliance. B. Ineffective for spores. C. Unsafe. D. Extreme. Question 33. A patient with highly infectious hemorrhagic fever dies. Which postmortem action best ensures infection control safety? A. Use full PPE, minimize manipulation, place body in double leak-proof bags, disinfect surfaces, and coordinate with public health for handling. B. Perform full autopsy immediately. C. Allow unrestricted family access. D. Remove PPE inside the room to save time. Answer. A. Use full PPE, minimize manipulation, double bag, and coordinate with public health. Rationale. High-level pathogens require strict post-mortem biosafety. B. Dangerous. C. Unsafe. D. Violates protocol. Question 34. A nurse reviewing microbiology results notices a sudden rise in carbapenem-resistant isolates across the unit. What is the most critical immediate action? A. Implement enhanced contact precautions and notify infection control to initiate outbreak investigation and molecular typing. B. Begin universal antibiotic therapy. C. Ignore until weekly review. D. Move all patients to new rooms. Answer. A. Enhance precautions plus outbreak investigation. Rationale. Sudden MDR rise triggers full investigation. Universal antibiotics are harmful. C. Delays. D. Impractical. Question 35. During transport of a patient with viral hemorrhagic fever, the nurse notices a tear in their gown. What is the safest immediate response? A. Stop transport, exit area safely. Perform PPE doffing per high-risk protocol. Then don new PPE before continuing. B. Tape the gown quickly and continue. C. Ignore tear unless visible fluid escapes. D. Ask a coworker without PPE to help hold the gown together. Answer. A. Stop, doff safely, don new PPE. Rationale. PPE breach requires full reset. B. Inadequate. C. Unsafe. D. Dangerous. Question 36. 3 patients develop central line infections from the same organism. Which intervention most effectively determines the contamination source? A. Perform line insertion audits, review aseptic technique logs, and culture IV fluid batches and central line hubs. B. Replace all central lines immediately. C. Tell staff to be more careful. D. Switch all patients to peripheral I versus. Answer. A. Audit plus culture plus review processes. Rationale. Systematic investigation identifies root cause. B. Unnecessary. C. Inadequate. D. May compromise care. Question 37. A nurse preparing to give medications notices a blood pressure cuff contaminated with stool. Which is the safest action? A. Remove cuff from service. Perform appropriate disinfection, sporicide if needed. Document breach, and obtain clean equipment. B. Wipe with tissue and reuse. C. Give medication first, clean later. D. Ignore if stool appears dry. Answer. A. Remove plus disinfect plus replace. Rationale. Contaminated equipment risks cross-transmission. B. Violate infection control standards. Question 38. A unit experiences increased ventilator-associated events. What is the nurse's highest level intervention to reduce multidimensional risk? A. Coordinate interdisciplinary rounds focusing on sedation, mobility, oral care, and early extubation readiness, ensuring adherence to the VAE bundle. B. Increase ventilator alarms. C. Replace ventilators weekly. D. Increase imaging surveillance. Answer. A. Interdisciplinary adherence to VAE bundle. Rationale. VAE reduction requires bundle plus team coordination. B. D. Insufficient. Question 39. A nurse finds a sterile tray with punctured wrap, but the surgeon insists on using it due to time pressure. What is the safest response? A. Refuse use, explain sterility breach, obtain new sterile tray, and escalate as needed. B. Use tray, but add extra chlorhexidine prep. C. Allow surgeon to decide, because it's their procedure. D. Tape over hole. Answer. A. Refuse use and replace tray. Rationale. Sterility breach equals invalid. Nurse must advocate for patient safety. Question 40. For patients require isolation room placement. Which combination best utilizes limited negative pressure resources? A. Place untreated TB patient plus measles patient in negative pressure. Place varicella patient with crusted lesions in regular room. Place influenza patient on droplet precautions. B. Place all 4 in negative pressure. C. Place influenza patient over TB patient. D. Place crusted varicella patient in negative pressure first. Answer. A. TB plus measles require negative pressure. Influenza uses droplet. Crusted varicella no longer infectious. Rationale. Prioritize pathogens requiring airborne isolation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.